Welcome to Behavioral Health Today, a podcast brought to you by the Triad Network. This podcast is designed to share trending topics occurring within the world and our communities and bring them a behavioral and mental health perspective.
Welcome to Behavioral Health Today. I'm your host, Sharlee Dixon. My guest today is Dr. Victoria Maizes. Victoria is an internationally recognized leader in integrative medicine and the founding executive director of the Andrew Weil Center for Integrative Medicine. In her groundbreaking new book, Heal Faster, Unlock Your Body's Rapid Recovery Reflex, she reveals why common recovery methods like R.I.C.E might actually be stalling our progress and how we can instead activate the body's innate rapid recovery reflex. As a professor and host of the Body of Wonder podcast, she joins us today to share an evidence-based roadmap for athletes and high performers looking to break the cycle of lingering pain and inflammation. I'm excited to have Victoria with me today to discuss her book, Heal Faster, and explore how to move beyond traditional recovery myths like R.I.C.E to activate the body's rapid recovery reflex using integrative strategies in nutrition, mindset, and nervous system regulation to accelerate healing and maintain lifelong physical vitality. So Victoria, it's so great to have you on the show today. Welcome.
Thank you. I'm really happy to be here with you.
Awesome. I'm glad you're here. I know that you've spent decades training physicians at the Andrew Weil Center for Integrative Medicine. What was the aha moment or the specific gap in Western medicine that inspired you to write Heal Faster?
Yeah, it's such a great question. I have been a physician for 40 years.
Wow.
In my time, especially the 30 years I've been practicing integrative medicine, I see people who really want to know, what can I do so I don't need these medicines? Do I really have this for the rest of my life? Is there a way I can reverse, fill in the blank, diabetes, arthritis? And so in my practice and also in teaching doctors, nurse practitioners how to practice this way, I have seen people dramatically recover. And I wanted to really get that word out to more people because I think there's limited access to integrative medicine. It's not in every community. Sometimes people can't afford it. Sometimes the doctor's got too many patients already and they can't get themselves in. And so writing a book was really an opportunity to share some of what I think is really important and not widely known to people in this country.
Absolutely. And I completely agree with you. I'm currently a social worker working in a dialysis center. So every day I'm working with patients who have these chronic illnesses, diabetes, high blood pressure, lupus, things that, that they are going to potentially have, dealing with for the rest of their lives or have dealt for, decades. Right. And so they're often trying to figure out what they need to do. How can they feel better? How can they, extend their life? Figure out what they should do next. And a lot of them don't have access to integrative medicine and what are the other options for them.
Right. And so in Heal Faster, which is my new book, I wrote about the things that I think are most amenable to either being able to get rid of completely. Like, for example, you mentioned diabetes. We actually have a lot of things we can do with people to help them reverse type 2 diabetes. So, type 1 is an autoimmune condition where the islet cells, which are the cells in your pancreas that make insulin, are actually destroyed. And we may have a cure for that one day once we really figure out how to do stem cell. But type 2 is that the cells are more resistant to insulin. So it's not like you're not making it. It's just not working as well. And in that situation, there's much that we can do actually to restore normal health, normal blood sugar control, and then hopefully prevent that bad outcome, which you just described as kidney disease, but also it can increase your risk of heart disease.
Right. And oftentimes I'm talking with patients, not just in my dialysis center, those who, have end-stage renal disease, but often, friends and family members who have other illnesses. And just before we came on, we talked about how I have children who are into sports and I'm, a woman in perimenopause. I'm 4 years old. My body's starting to do things. I'm starting to feel ways. And we often think about healing in all of those arenas as a passive type of process, something that it'll just get better with time, or maybe it won't, but it's passive. It's something that just happens or it doesn't. Can you
Right.
explain the rapid recovery reflex? Like, what is it and why is it a proactive state that the body must enter?
Yeah. It's an interesting word, passive, because something's actually happening. You
Mhm.
just don't have to do something. So the something that's happening is often automatic. So again, let's use blood sugar control because we've been talking about that. So when you eat a meal, your body begins to break down the food and it causes usually a bump, a rise in your blood sugar. And then your body brings that back under control and back to a normal blood sugar. That is happening without you having to say, turn on the insulin, turn on the I mean, something internal is happening that isn't actually passive. It's just automatic. And so that automatic response is part of your intrinsic ability. It's an ability that your body has and knows what to do and how to manage all kinds of things. Blood sugar. When you get sick, you may get a fever. Well, why does your temperature go up? Normally, we're pretty well regulated at a, 98.6, or so. It varies a little bit, but you're not doing something in particular, even though it might be a cold winter day in Idaho, or it might be a really hot summer day in Tucson. And yet we maintain our body because, again, we have these physiological mechanisms that maintain homeostasis. They bring us into this normal range. And so the rapid recovery reflex is that ability that the body has. And then the question is, why doesn't it happen all the time? Like,
Right.
why is it that sometimes you do develop diabetes? What's gone on that the body malfunctions or errs? And when that happens, what can we do to get it back into homeostasis? So a lot of what I write about in Heal Faster is, what do you do when things are not going as planned? And how
Mhm.
can you be, your word, proactive to restore homeostasis, to activate that rapid recovery reflex so that you end up in excellent health as opposed to, with one, two, three, four chronic diseases?
Right. And the fact that you mentioned homeostasis, I was writing that down because that really is what our body is in that
Right.
state of all the time. That homeostasis and trying to remain there is and again, we think of it as a passive process, but it really is our bodies working to keep that
Right.
level all the time. But then sometimes it doesn't work, right? And so
Correct.
how why do some people, or especially athletes, because I'm really interested in that, especially things like rice, and we'll talk about that in a minute, but
Yeah.
why do so many people find themselves with lingering injuries or lingering illnesses? Why does that happen?
The athlete question is such an interesting question because, we all get injured sometimes. We're playing basketball, we turn our ankle and twist it, and we strain it or sprain it. And so it gets a little swollen, it gets hot or warm, it gets tender. And again, usually with TLC, it gets better. So, first of all, what's happening? Why is it getting hot? And why is it a little tender? And why is it swelling? So, that is inflammation. And inflammation's kind of gotten a bad rap. We
Yes.
have learned that inflammation is the root cause of a lot of illnesses like heart disease and Alzheimer's disease and things that end in itis like
Mhm.
arthritis. Inflammation is part of what's going on there. And that's really chronic inflammation. And chronic inflammation can be a problem. We'll talk about, what to do. But the truth is, inflammation, acute inflammation, short-term inflammation, is really part of your body's rapid recovery reflex. It's your normal response to an injury. So when you twist that ankle and it swells, you're bringing in more blood flow with more white blood cells to repair, to reduce the likelihood that you'll have further injury, to begin the cellular regeneration that's necessary. And so that immediate response is actually a positive thing. It's your body working to repair the injury. And that doesn't mean it's comfortable, by the way. When it's
Yes.
swollen, it's not comfortable. When it's tender, it's not comfortable. But it is a sign that your body's doing what it's supposed to do to heal. And that's why this thing called RICE, which
Mhm.
stands for rest, ice, compression, and elevation, used to be our advice and now is no longer our advice. So rest is still good to some extent. We do want to protect the joint. If you've sprained your ankle, you don't want to go right out and play basketball on that ankle again. You want to put an ace bandage around it. You want to wear a tight sneaker, high top. You want something that's going to protect yourself from re-injuring in the short term. But you don't necessarily want to be off of it for a week either, because then you start to lose some muscle strength. So we now talk about, rather than rest, we talk about protection. We should protect that joint. So the next part, the ice. Well, the problem with icing is it reduces that inflammatory response, which, as I said, is actually a beneficial way in which your body starts to begin the healing process. And so ice is nice because it reduces pain. The message on the nerve fibers from ice to the brain gets there faster than the pain message. So when you ice it, all of a sudden you go, oh, it doesn't hurt anymore. This is awesome. But we no longer recommend icing as a healing strategy. It might still be used sometimes for the pain, but we know it can actually interfere with the healing. And then compression, that's still okay because we want to minimize the swelling. We don't want too much swelling. And that's why elevation is also good. If you elevate it above the level of your heart, then you're going to have less swelling than if it's dependent, which normally our feet are below the level of our heart. So
Right.
those are true. But the other thing that we now tell people not to do is not to take what we call NSAIDs, or non-steroidal anti-inflammatory drugs. So that's your ibuprofen, your Motrin, your Aleve, naproxen, those kinds of medicines. And once again, that's because we have learned that when you take those anti-inflammatories, you interfere with your body's inflammatory response. And there's actually some evidence that when you take the NSAIDs, you increase the risk that that acute pain is going to become a chronic pain. So you could still take Tylenol. That's okay. The wrapping with the ACE bandage is going to make it feel better and hurt less. But you really want to be much more mindful. And even the guy who invented that acronym, R.I.C.E, has now retracted. He's now said, no, that is no longer considered the best treatment.
Interesting. And so you're kind of blowing my mind here, Victoria, because in my head, and I literally rolled my ankle like a month ago, out walking soccer field while my children practiced. There
Right.
was a hole that I did not see. And I did come home. I tried to keep walking. I had no choice because I had to get to the car. As soon as I got home, I did ice it. It did feel better, but I do still feel like my ankle still hurts even a
Yeah.
month later. So I
Yeah.
really just made it worse, is what you're telling me?
Well, you might have made it worse. This is our
Okay.
concern. I can't say for sure. I'm not sure if anyone could say for sure, but it's like
Yeah.
now we've changed our recommendations. And I'm sorry it still hurts. I will tell you that that's not that uncommon. And that's because when you roll your ankle, you're either stretching or maybe slightly tearing the ligaments. Now, if you have a terrible ankle sprain, like what we call a grade 3, you've literally torn the ligaments and then it's very unstable. And you probably wouldn't have been able to walk home, even with pain. You would have been like, oh my God, I can't get my balance. I can't do what my foot is supposed to do. But the ligaments are fibrous and they don't have great blood circulation. And so it's an injury that takes longer to heal. If you cut like your finger or let's say something on your face, it heals super fast because we have such good blood circulation to the skin on our face and our hands. But the ligaments, in the way that they are more fibrous and less vascularized, meaning they have fewer blood vessels going to them, do take longer to heal. And so I wouldn't worry terribly that at a month out, it's still not 100% better because it can take some time.
Got you. Wow. Okay, then. Is the suggestion just to protection, compression, elevation? We don't do any ice. Would you do heat instead or just those things?
Yeah, you can do heat. heat, you better not like acutely, but now a month out you can. And heat
Okay.
actually is another way to manage pain, because just like that ice moves faster on the nerve to the brain to send a message, so does heat. So both of those, temperature travels faster than the pain signal. And so like if your low back hurts, if your knee hurts, heat is really your friend because it just sends a much more rapid signal, but it also brings more blood. And I just said one of the issues with the ankle sprain is that it doesn't have a lot of blood flow. So you're bringing more blood flow to the area, which then helps with the healing process. So there are some other things that we do recommend, and that's that I haven't heard you say you did this, but some people are just like, I'm going to stay off of it until it's well. And you actually do want to put some load on it. And if you do watch professional athletes, it's amazing how fast they get them back up and moving. And the reason for that is if you go to bed rest, for example, which, we don't do so much anymore, but say we just put you on crutches, you're not challenging those muscles. And as a result, they atrophy. You lose muscle strength. Well, professional athletes never want to lose muscle strength. And, they've done studies where they can take a little tape measure and wrap it around, and they show that the circumference around the muscle is smaller than on the other leg. And so athletes never, ever want to, lose any muscle strength. And so they are walking with some kind of like walking cast if it's bad, or an ACE bandage, or it's taped. And so they are loading it with weight, but they're also doing exercises. So for an ankle sprain, what I usually recommend is that people start to trace the letters of the alphabet with their ankle. So you just take it through, A, B, and through the full range of motion. The alphabet is a nice way to do that. And then if your ankle's really not getting better over time, sometimes it's good to go get it examined. I mean, once in a rare while, it's something else. You have a hairline fracture of the end of your bone, and you didn't realize it because it seemed like an ankle sprain. So when
Right.
it's not recovering, then it's also a time to say, maybe you need to look into this a little deeper.
Got you. Well, okay then. Starting to change how I look at injury recovery. Definitely do that. So doing this podcast, I've started to really look more into, or I guess develop my thoughts around the connection between mind and body. And I'm really starting to understand that there's a huge connection between,
Yeah.
how our body functions and how our mind functions and how they connect together. And so I'm really wondering what your thoughts are on our body's healing processes and the nervous system. Like, is there a connection there? And do we heal better or faster depending upon the state of our bodies? When we're stressed, is it a faster or slower process? Does that make any difference?
Yeah. Yeah. So stress does interfere with our healing, our rapid recovery in a variety of ways. And again, this is like that invisible physiological stuff that's going on behind the scenes that you
Yeah.
may or may not really be aware of. So the first thing is that when we're stressed, our brain, our hypothalamus, talks to our pituitary gland, which then talks to the adrenal, which is this little gland that sits right above the kidney. And the adrenal gland produces more cortisol. Many people will have heard of cortisol. It's sometimes what we call the stress hormone. Well, that stress hormone, that cortisol, will reduce your pro-inflammatory cytokines. So those are those chemicals that I was saying are important for initiating a healing response. So when your cortisol's going, you don't have as robust an inflammatory process, and that interferes with the healing. Another thing that happens is when we're stressed, we go into fight or flight. Most people will know that expression, and that has to do with our sympathetic nervous system. So when we're in fight or flight, some of our blood flow is increased and some is reduced. So the increase in our blood flow is like to our heart, to the big muscles, because we're getting ready to flee. We need blood to our heart to get it pumping and be able to run. We need blood to our, thigh muscles and our butt so that we can run. But we don't put as much blood into our periphery. What happens is we vasoconstrict. We shut down that blood flow. So if you ever notice when you're really stressed, your hands are cold. Why are your hands
Mm.
cold when you're stressed? Maybe you go to the doctor's office and, they shake your hand and they say, oh, your hands are really cold. Well, maybe
Yeah.
you're anxious in that doctor's office. And so
Mm.
actually, I notice when I shake someone's hand, are their hands cold? Because it's one of those signs that somebody is a little bit in that sympathetic nervous system overdrive. So if you're trying to heal, let's say, a wound or something that's much more superficial, it's not getting the blood flow it needs because you're in that fight or flight. Another thing that happens often when we're stressed, we don't sleep as well. And sleep is when we do our repair. I mean, that people go, why do I need to waste 8 hours a day? I'm like a third of my life, I'm sleeping. Well, sleep is not an inactive time. It is when our immune system reboots, and it's when we do a lot of cellular repair. And so if we don't sleep enough, or if we don't sleep as well, we don't get that deep sleep. Deep sleep is when we produce growth hormone, which is very important for cellular repair. So there's a lot. I probably could give yet more ways in which our physiology is affected by being stressed. But I'll give you one research example. This is now a while ago, but they did a study of people who are caregivers. So, that's really stressful. If you're taking
It is.
care of a loved one who has Alzheimer's, for example, or someone who's got advanced cancer, I mean, it's very stressful. So they did a study where they had people come in and have a skin biopsy. So that's like a very controlled wound. And by the way, they volunteered and they were paid, but they had this little skin biopsy. And the people who were caregivers, it took them 40% more time to heal than the average adult of the same age and gender.
Wow.
So it's like, it's something we wouldn't necessarily realize, but that stress affects our healing.
Wow. Interesting. I mean, it makes complete sense. I would have never thought that, but it makes a lot of sense
Yeah.
that just it takes so much more out of you when you're
Yes.
stressed.
Right.
And healing
Right.
is it takes a lot longer too. That's really
Right.
interesting.
But I want to say one other thing about stress, because, sometimes stress gets a bad rap, like all stress is bad. But the
Right.
truth is, like, stress makes us grow. If we had this life where which is like totally cushy and we never did anything challenging, we also wouldn't be growing. And so, you mentioned your kids are athletes. Like, if the
Mhm.
coach never gave them anything harder to do, they'd never get any better.
That's right.
And so there's what we call eustress, EU stress, and that's considered the good stress. So stress is a little bit like what we call a U-shaped curve. If there's really almost no challenge, we don't grow. If there's extreme challenge, we can overload and go and just have a meltdown or burn out or just like be unable to function. But there's actually this like ideal amount at the top of the U. It's an upside down U at the very top of the U, but we function optimally. So again, we're talking about exercise. When we exercise and we do something that's harder for ourselves than we normally do, we
Mhm.
actually get some inflammation in that muscle. We may get some micro tears in that muscle, but you know what? Then the muscle gets stronger. So anyone who weightlifts knows they gradually increase the weight. And it's hard. And then it kind of gets to be not hard. And that's
Yeah.
when you got to bump it up a bit. And so this concept of when we stress ourselves and we grow from it is called hormesis, with the idea that we adapt to these increased challenges that we give ourselves. And it's not just with exercise. I mean, another example is heat. If you're always in this perfect 74-degree, temperature controlled, maybe you live in San Diego, it never gets very hot, never gets very cold, you aren't as adaptable to very cold weather or very hot weather. And so one way they have studied this is they've looked at people who go into either hot tubs or saunas. And what they find is that heat exposure actually increases their cardiovascular health, and they have a lower risk of heart attack or stroke. So I don't want people to think, oh, that's stress, it's only bad. It actually
Mhm.
can lead us to growth.
Nice, nice. And so then even along those same lines with exercise, how do we know where that line is though between that healthy eustress of the workout and push of life, whether whether it's a workout or not, to the bad or the maladaptive type of stress that can lead to an injury or chronic pain or negativity? Like, where do we
Yeah.
know where that line is?
I wish I could give you a one size fits all answer, but it is going to
Mhm.
depend on like our age, our
Mhm.
genetics, our
Yes.
gender, our fitness. You mentioned perimenopause. As
Mhm.
women go through menopause, if they don't take a hormone replacement, their joints and ligaments aren't as flexible over time. And so there's a lot of different things. Of course, your baseline fitness, you ask an athlete to bump up a little bit, that's very different than you ask someone who's been really sedentary to bump up a little
Yeah.
bit. And so there's not a very easy answer to that. Of course, we sometimes know when we've overdone it, right? Like,
Yeah.
say we haven't hiked in 6 months and we go take an awesome hike, and then the next day we feel like we can barely move. Well, we
Right.
might
Oh,
have overdone it.
Right. Oh, when you've done it, right?
Yeah, right. And that isn't terrible because that's not usually a bad injury. But sometimes we overdo it where, yeah, now we've got back pain, or now, we've hurt ourselves in a way that takes longer to recover from. And so
Right.
there's a little bit of intuition, there's a little bit of common sense. If you're working with a trainer, they may be able to guide you because they know you. But I can't tell you that there's one just perfect, easy answer for anyone. And I think the way we know this is like, look at the elite athletes. They get injured all the time, right?
True. That is
They're
true.
pushing,
Yeah.
and then if anyone should know, it should be them, but they're
Mhm.
pushing themselves. They're ambitious. They've got drive. They want to be at their absolute best. And sometimes they miss what that perfect edge would be,
Right. Right. But then they don't give up, which is
right? They don't get, yep.
we'll be right back after a word from our sponsor.
Nearly 9 in 10 registered voters believe the nation faces a mental health crisis, according to a new USA Today Suffolk University poll. Americans are more concerned than ever about their mental health. Mental health first aid provides the resources and training to identify, understand, and respond to signs of mental health and substance use challenges. It provides the confidence and skills needed to offer life-saving assistance, and it provides peace of mind. Our experts provide mental health first aid training for adults, teens, caregivers, veterans, law enforcement, EMS, and school faculty. Mental health concerns are on the rise, but evidence-based training through mental health first aid can make a difference. Visit mentalhealthfirstaid.org to find a course near you, or email hello@mentalhealthfirstaid.org to schedule a training. Courses are available for individuals, groups, organizations, and companies of all sizes. Visit mentalhealthfirstaid.org and make a difference in your community.
Okay. So a little bit earlier, we were talking about inflammation in the body and how it does kind of get a bad rap, but at the same time, a bit of it is protection, right? Uh,
Right,
Here recently, I will be honest and say I do spend a bit of time on social media. And here
yes,
recently, I've seen a lot of the anti-inflammatory diets, especially for
right,
women, and
right.
ways that we should eat to reduce the amount of inflammation in our diets. What are your opinions about anti-inflammatory diets? Is it something that we should all try to do or try to eat better with? Is it the one size fits all type of thing that it's, said to be? And are there critical micronutrients or shifts that we should change as we age? Especially with protein, I keep hearing as an over 40-year-old woman, I need to have at least, I don't know, 120 grams of protein a day. What are those things? What are your thoughts on that?
Yeah. So you have a few questions there. Let's just start
Okay.
with the anti-inflammatory diet, then we could go to protein, because I think these
Okay.
are such great questions and so many people are wrestling with this.
Yeah.
The anti-inflammatory diet, in a sense, is a little bit of a variant of the Mediterranean diet. So the Mediterranean diet is super well studied. It's been shown to reduce the risk of heart disease, of Alzheimer's, of infertility, of depression. I mean, those are really diverse set of
Yes.
conditions. And so
Yeah.
it's got a huge body of evidence supporting it. And the big parts of this diet, as we think about it, is it's high in omega-3 fatty acids. So in the Mediterranean, a lot of that, like, it's on the sea. And so people eat a lot of fish. And that's where the main source of omega-3s come from, especially from those fatty fish. We sometimes call them smash fish, which stands for salmon, mackerel, anchovies, sardines, and herring. Those are really rich sources of omega-3s, and we need that. That's the anti-inflammatory essential fatty acid, and we tend to not get enough of it in the diet. So that's awesome about Mediterranean and AI. I'll call anti-inflammatory diet AI diet.
Okay.
The second thing is we look at diet that doesn't bump up your blood sugar sky high. So that means that you're eating what we call complex carbohydrates. So what you're not eating are baguettes and crackers and chips and pretzels. What you are eating are legumes and whole grains, like a whole wheat berry or steel cutouts, things that are whole, that are slowly broken down. And so they don't cause those spikes in blood sugar. So that's the second part of the AI diet, is you keep your blood sugar steady, low and steady.
Okay.
And then the third part is you get your antioxidants, and the antioxidants come from vegetables and fruits. So those are the three main things that we look for. And then in the AI diet, there's some interesting additions. Like we focus on spices that have anti-inflammatory effects, like turmeric and ginger. We
Mhm.
add things like medicinal mushrooms, which have this health beneficial effect. So reishi, shiitake, maitake, it used to be impossible to get these, but now they've learned how to cultivate them. And so they're in a lot of grocery stores. They're not so hard to find.
Right.
And they're very healthy to include in your diet. So that's broadly what the anti-inflammatory diet emphasizes. And then what it reduces is it's less meat, especially beef and pork, less of those ultra processed foods. So it's very much a whole food kind of diet. You walk
Okay.
the produce aisle, you're not like getting all the stuff in the packages.
Around the outsides.
Yeah, you're using olive oil as your main fat instead of a cottonseed oil or a sunflower seed oil or something like that. So it both has things that it encourages and some things that it discourages.
Okay.
So is it a healthy diet? From a public health perspective, yes, it is a healthy diet. Is it the right diet for an individual person? Well, we're learning more and more in personalized medicine that there may not be a one size fits everyone. So say
Right.
you've discovered that you're sensitive to dairy. A lot of adults don't have the enzymes to digest milk sugar, so they're lactose intolerant. Some people don't do well with the milk proteins like casein and whey. So if you're someone who's sensitive to those things, even though the Mediterranean diet includes cheese and yogurt, not so much milk, but cheese and yogurt, you don't do well with them. Your system doesn't do well. So you're better off avoiding those foods, and that would put you on a slightly different diet. Maybe you've discovered you're sensitive to gluten, and you do better when you avoid wheat in all of its forms, even though it's
Mm.
a beautiful cracked wheat berry salad or a farro or something that you're making that looks super healthy. But if your body doesn't do well, some people react to eggs or soy or citrus. And so I think that this idea that everyone should eat the exact same diet is an idea that's kind of going away. And then there are
Yeah.
a few people who really do well with what we call a very low carb diet. So when we were speaking about diabetes earlier, some people find that if they go low carb, so they basically eliminate the pretzels, the chips, but even things like rice, which might be for many
Mhm.
people a healthy food. They just get rid of carbs, they still eat fruit and vegetables. So not totally, but those grains and the processed foods that are made from them. And instead their diet is a salad with a piece of fish. And there is no baked potato on the side or a baguette on the
Mhm.
side. They actually are able to put their diabetes into remission by being on that, what we call low carb diet. So, what's your goal? What are you treating? What's your cultural heritage? You tell
Mhm.
someone from East
Right.
Asia that they shouldn't have rice, they are not happy with you because it's such an important staple of their
Yes.
diet. But I think that while yes to anti-inflammatory diet, yes, there's a lot of evidence, it still might be not be the right diet for absolutely everyone. And then you
I
asked
see.
about protein. And protein's having a moment, we
It
have
is. It is.
we go through phases where we were like, low fat is good. And then people ate a
Mhm,
lot of processed food and carbs. And then we were
mhm.
like, maybe fat is actually more healthy than we thought, as long as it's avocado and as long as it's olive oil. And I agree, those are healthy fats, monounsaturated. But now we're like, everybody needs more protein. And so the question is, does everyone need more protein? Well, maybe. I would say it may be that the RDA, which is zero 0.8 grams per kilogram, is a little too low. And scientists, researchers, doctors are rethinking that and saying maybe it should be 1 gram per kilogram and not zero 0.8 or maybe even 1.2. We also know that if you're over 65, you may need more protein. And that's
Okay.
because we have this real risk with aging. I didn't get to 40 yet, but with aging, we have this real risk that we are going to get frail and that we're going to lose
Mhm.
muscle. We have this gradual loss of muscle unless we're weightlifting or hiking or doing other things to stimulate those muscles. We
Right.
gradually lose some muscle every year. And so it might be that pushing a little extra protein, and a little extra might be like 1.2 to 1.6 grams per kilogram. Again, not huge amounts. And then we have someone who's having surgery. And when you have
Mm.
surgery, that puts you into what we call a catabolic state where you break down your lean body mass. So then you may need 2 grams per kilogram. If
Mm.
you're someone who's a competitive bodybuilder, you may need more to build those muscles because
Yeah.
you are really working the muscles hard and your goal is to grow muscles. And so you may need more. So again, I think you're hearing there's not necessarily a one size fits everybody. In
Specific. Okay.
perimenopause, I think the answer again would be individualized and is one of the proteins that's really being
Mhm,
encouraged for
mhm.
peri women. There's some suggestion that it may not only help muscle strength, but it may also help brain. And some of the
Mm.
sometimes people have a little brain fog in
Yeah.
perimenopause, and the creatine may help there. Also, that loss of muscle goes up a little bit as we're in our perimenopause and menopausal years. And so
Mm.
by increasing the protein a little bit, that may be helpful. But I'm mostly like, let's do what we can with food, a food first
Okay.
as opposed to a supplement first. And like people sometimes don't have so much appetite. And so then they might add a
Mhm.
little protein to a smoothie or something like that. You want to be discerning. Some of those protein shakes, they've got so much sugar, they've got
Yeah.
so much
Yeah.
additives and flavorants and sweeteners.
Mhm.
Like get some really simple protein powder that doesn't have stuff. If you're not insensitive to dairy, whey protein may be the one that's best absorbed and
Okay.
make your own smoothie. Like put in greens, put in almond milk, put in a fruit to make it sweet. You don't have to buy a pre-sweetened one. And that's
Mm.
going to be much less of a processed food and much healthier. So if you really want to do a protein smoothie, if that works for your lifestyle, I would say be thoughtful about what you're doing. It's much cheaper too. A lot of those shakes are quite
Absolutely.
expensive.
Yes, yes, they are. And like you mentioned, they're just full of everything that they should not be. And they
Right.
just tell you on the packages the good parts. They don't really, they leave out everything in there that is really
Yeah.
bad for you.
Yeah. Yeah. All your listeners, look at the back of the
Yes.
label, and like look at that ingredient list. And if there's 27 things on it, it's probably an ultra processed food.
Yeah. Yes, yes, yes. Be careful of those. Be careful of those. I want to just park at aging for a second there. I know just again, as an aging person, I guess we all are at this point. I want to talk a bit about arthritis. Is arthritis something that all or most of us, is it something that we will all deal with? Is it a common part of aging? So losing that ability to move freely or to stay strong, or losing that muscle mass, is that something that we will all have to deal with? Is there a way around it? Are there, movements to help that or to reduce it? What do you think?
We do not all have to end up with arthritis. Having said that, there are some inherited forms.
Mm.
I can't tell you how many people say to me something like, oh, my hands, they look just like my mother's hands.
Yeah.
And it's just like it just happens to them. And so we can talk in a minute about what you might do to manage that. But arthritis can be a result of injury. So, somebody describes, oh, they had this terrible knee injury when they were young, and then that creates some chronic inflammation. And 20, 30 years later, they've got arthritis in that knee. Arthritis can be a result of what we call malalignment. So, for example, if you're knock-kneed, you're putting some funny pressure on one side of the joint, and that can then, as you get older, lead to some arthritis. So you can get it for a variety of reasons, but it is not like everybody's fate and just everyone's ends up with arthritis. Also, maybe you have like a little flare of arthritis because, it gets really cold and rainy where you live and you ache in a certain place. But then, the sun comes out and the weather gets better and your joint feels just fine. So sometimes we're sensitive to certain kinds of weather conditions. People are getting joint replacements. The magic of orthopedic surgery, which really gives people their passion back. I mean, people who can't hike, can't play golf, can't sit on the floor with their grandchildren, and they go and they get their knee or their hip done, and they're just back to doing all their favorite things. So the good news is that we have advanced in medicine where, sometimes things can really be repaired if that's what ultimately is required. Before you ever need to have that, there are things like taking turmeric, which is a spice and a dietary supplement, and it's anti-inflammatory. And sometimes that's enough to get the joint to quiet down and feel much better. Sometimes the fish oil, the omega-3 fatty acids, can have that effect. There's another dietary supplement called SAMe, which is S-adenosylmethionine, and sometimes that helps the joint. So there are a variety of things like that. There are some medicines that can help joints feel better. There are injections, and we used to go to cortisone for an injection, but now we have things like hyaluronic acid, which is really that nice cushioning of the joint, and that can be injected. There's PRP, which is platelet-rich plasma, and people are getting injections of that. They draw your blood, they spin it, and then they just take the platelet component and put it back. So we are seeing huge advances in the treatment of arthritis when it does occur, but I definitely don't think that it's everybody's fate. Muscle is a little bit of a use it or lose it. We know, for example, if someone's hospitalized and they can't get out of bed for 10 days, they may lose 10% of their muscle mass in those 10 days. So bed rest is really not our friend, getting up and moving. And that's why if you have, for example, that hip surgery I mentioned, they'll get you out of bed that very same day.
Yeah.
A woman has a C-section, they get her out of bed that
You're up.
same day. It used to be, my grandmother told me when she had her babies, they had what was called lying in, where for 2 weeks you didn't get out of bed. They brought you a bedpan, and you laid
Wow.
the baby. They brought you the baby, and so we've come a long way from that
We
time.
definitely have.
But it is, I think, a really good idea for women to be, especially women, because women tend to have a smaller muscle mass to begin with, to say to themselves, what do I need to do to maintain my muscle strength? And it might look different at different points of life. When you're a teenager and you're out and you're, playing pickup basketball, or you're, riding your bike and you're just running places, you may not do anything. But, as you get older, you really have to think about, okay, my muscles, my bones are dynamic. They respond to the stress I'm putting on them. What stress? What am I asking them to do? How hard am I asking them to work? And you want to ask them to work hard so that they get strong and stay strong.
Thanks. Thank you for that. Because it is just as we get older, and depending upon your job that you do, I moved from a position. I used to work in the school system. And so I was always moving, always everywhere,
Yes.
up and down on the floor, working with elementary school students all over the place. Body did not hurt, felt great. Moved into a position now where I sit a lot and now my body hurts. And so I had to incorporate much more movement, purposed movement
Yes.
on my own. I
Yeah.
sit in traffic. I drive a lot more now than I used to. So you're absolutely right. You've got to, train yourself to do more movement, not just as you age, but also as your lifestyle may change, to make sure that you are getting in that purposeful movement, to make sure your body doesn't just sit.
That's great advice.
Yeah. So, here recently, your book was highlighted as a top nonfiction pick by Amazon. Congratulations. So,
Thank
for
you.
those, absolutely. So, for those who are ready to dive deeper into these strategies, where is the best place for them to pick up a copy and learn more about your work?
Well, happily, it's at all bookstores, whether you like an independent bookstore or you like the big online bookstores, it's at a variety of places. You also can get it at the library. And if the library doesn't have it, you could ask the library to order it. And they will do that usually for you if you ask for a book to be ordered. So it's widely available. If you like to listen to your books, I did do an audible recording of it, so you can listen. There's an e-reader, so you could get that, and it's out there.
Very nice. Very nice. Well, Victoria, I have really appreciated you speaking with us today.
It's been such a pleasure. Thank you so much for inviting me to be on.
And thank you to our listeners for taking the time to join us. You can follow us on our social media at Instagram, TikTok, LinkedIn, YouTube, and more at Behavioral Health Today. And if you like our show, make sure to give us 5 stars and leave us a review. As always, the resources for this episode and an archive of all of our other episodes can be found on our webpage at triadhq.com/BHT. And we look forward to having you back with us next time on Behavioral Health Today.
We appreciate all the support from our community, and if you like our show, one of the best ways you can support it is by giving us a 5-star rating and leaving a review. Behavioral Health Today is a podcast part of the Triad Behavioral Health Network, all rights reserved.